Hi guys, William Quang here, Adelaide Heel Pain Guy with
Mim.
from the Adelaide Heel Pain Clinic. So we're going to talk about ultrasound today. Now there's two types of ultrasound. One is diagnostic ultrasound and the other one is therapeutic ultrasound. Now the diagnostic ultrasound is where you go to a place like Benson's, Fowler Simmons, radiology SA, and you can get an X-ray or an ultrasound scan, MRI. So that's where you get a scan. Now what we're going to talk about today is what supposedly was used as a treatment for heel pain, and that's therapeutic ultrasound. So this machine here is a therapeutic ultrasound machine. So Mim, do you want to tell us our thoughts on therapeutic ultrasound and treating heel pain these days?
Yeah, definitely. So the first step, like what Will said, is to know that there are two different things between the therapeutic and the diagnostic, but also the therapeutic ultrasound is different from the shockwave therapy that we use here at the clinic as well.
Hey Nelson.
So the idea behind the therapeutic ultrasound is that it's meant to be able to increase the blood flow down to around those areas of soft tissue and increase healing through there. It's meant to soften the scar tissue as well. And reduce any swelling that is present too. But unfortunately, there's been minimal evidence saying that it's quite effective, and that when it's compared to a placebo, there's not too much there to say that it does work better. It may have some placebo effect, but we don't normally recommend it as an evidence-based practice.
Yeah, so this machine here is an ultrasound machine. So people may have seen these machines who've had physio and podiatry, chiropractic type work. But those practices are probably about 10 years old or longer. Now, I remember having this done on me when I was about 20 years ago, and it didn't really work for whatever issues I had. I think it was shin pain at the time and ankle issues. But at the time, that's what everyone thought worked all the time. So these physios were using it, and it wasn't really working. Now, when we started up the practice, we actually inherited one of these machines, and that's where this is, and it has gathered a lot of dust because we haven't found. We used it, I think, for the first 2 years and realised, hey, this ain't fixing patients, so we're not going to use it for heel pain. Okay, we do use it occasionally because therapeutic ultrasound can be used to determine if someone has a stress fracture in the shin or in the foot. So sometimes if we're not 100% sure, we might actually turn the machine on and we place the ultrasound on the potential small fracture, and if it hurts a lot, then we know we've got a fracture in there, and we're pretty good from there. Okay, so yeah, take home message. Unfortunately, studies showed it. I can say from personal experience, it doesn't work, and Mim can say that she's never seen one before because she hasn't been practicing for about 10-15 years. Okay, so if someone says, let's try ultrasound, just be quite skeptical about it because, it doesn't work. All right, hope that helps, guys.
Cool. See you guys later.
Glad Miriam informed you, Nelson. See you around.
Bye.
Bye.